I started looking at a few YouTube videos because I know we also talked about like the intersection of faith and mental health. And that I think for a long time, faith communities definitely, or the general sense was that mental health treatment and faith were incompatible. But I was looking at some YouTube videos about this just to kind of prepare. And I think there are a lot of efforts to basically create partnerships between mental health treatment and the faith communities, that they are not incompatible. Actually, they really should be a partnership and working towards like overall health and wellness. And I know that there is an effort by these two Black male psychologists, I don't remember exactly where they were, but going into churches and providing additional information about mental health treatment to make sure they also knew what mental health treatment looked like. And that those two things aren't mutually exclusive. Just like if somebody like fell and broke their leg, they'll pray about it and they're gonna go see a doctor.
Yeah.
And I feel like it's the same thing. If you have a mental health condition, you can pray about it, pray for healing, pray for comfort, pray for like strength and knowledge and all those things, and you can go see a doctor. Those two things both can happen.
Right. Because it's not uncommon for people to be frankly discouraged. I'll have people who'll come to see me, they'll go through the whole interview and say, be not troubled. There's a lot of kind of Bible verses that have that, and they're like, I'm just not going to accept this anxiety. I'm not going to claim it. I hear a lot of people using that terminology, and what I try to do is educate people. It's not about claiming it, right? Just like if I had a cancer diagnosis, I don't have to claim it or not. It's like something that's actually happening to me. And so I think to just provide that education when it comes to mental health. It's not that you have to claim it or, the other kind of terminology that's a lot of used from faith communities. Mr. Ketchen was saying, you can do both. And I encourage people to do both.
That's right.
Yeah, there's no reason why you can't do both.
Sweet. All right. Now this one right here is a good one though. This one is a good one.
They all be good.
Yeah, they're all good. However, this right here is what all brothers think. All right. Everybody that see a doctor don't matter. When people think I'm crazy if I seek a counselor, I'm gonna answer that. Nah, I'm not gonna answer that. I'm gonna let y'all, cause y'all the paid professionals. So.
I mean,
however, I'm the client though.
But they might.
Yeah.
People really might think that people might use that word, and I know some people who are listening may object to the use of the word crazy. I use it. I think in mental health we use humor a lot just to defuse things, and I hope no one feels stigmatized by it. But yeah, people might think you're crazy, but the key is it's very unlikely that your provider is. So people come to me all the time and they say, Doc, I'm going to tell you something. It's weird. It's the craziest thing you're going to hear is this. And I'm telling you, there is very little that you can say that I have not heard before or that won't seem weird to me. So it's very unlikely that anything you have going on or that you're thinking is going to be something that's going to be totally outrageous to your doctor. Actually, when Bethany and I were talking last night, I think in like the last 2 years I have been practicing, there is one person who told me something. And I thought, that's different. That's something I don't hear every day, But that was one person in 10 years. So, yes, people in the community may think that, one thing we talked about is what we can do to destigmatize this. So, for example, one suggestion I always have for patients who say, my mom is saying this or my wife or whatever is, they can come to an appointment. Why don't you invite them next time? And they can actually see me. A lot of people have no idea that there's not a lot of Black psychiatrists, Black medical providers in general. The psychiatry is very low. And so I think just to say, like, look, I'm Black too. I'm part of the system, but I have this information. I can talk to you about the mental health condition. Somebody actually thought, how they call psychiatrists shrinks? Somebody said to me, it was like, when you gonna shrink my head? And I had no concept that people thought we were really shrinking heads. I don't even know what that means, what that entails.
Voodoo.
It just goes to show you people do have those beliefs. So hey, ask her wife if she wants to sit in next time. She can ask me her questions directly. And a lot of times that'll go along with these things too.
All right.
And if people aren't necessarily comfortable with that, there are other ways to get family members and supportive others information. There are definitely different alliances like NAMI. There are a lot of resources that you can find online that will help kind of destigmatize mental health treatment and provide people information so they have also a better understanding about what it is. Or you can choose to not say anything at all, because you are not obligated to tell anyone really that you are seeking mental health treatment. If you decide that what you need to do to take care of yourself best is to not share this information for a while, that is also fine too.
All right, hold on. I got a scenario for y'all. So, all right, I'm y'all client right now, and hey, doc. So
I don't even know how this gonna go.
My wife pissed me off today. So I decided to go for a ride on 85 with our dog, and I threw it out the window, and then I went back home. Do I get any medication or do I get locked up?
You want to go with that?
Again, just like prayer and mental health treatment are not mutually exclusive, neither is medication and going to jail.
Hey, I just let the window and just threw it out.
Go ahead, Dr. Dooley.
Like for me, I would, again, like as I was saying, it's very unusual for people who have mental health symptoms to be violent. So to me, that would be something that I would not hear every day, where there's violence against a person or animals. That would be pretty unusual. So I'll be perfectly honest. Depending on me, if he on 85, it's not likely that something's going to be prosecuted. Just being honest. Even if I reported that, it's not like that a person is going to be charged for that. But to me, that would actually be one of those unusual times.
Don't tell Mike Vick that. Don't tell Mike Vick that.
Well, he's no different. He had witnesses for what he did.
He went to Leavenworth. He went to Leavenworth.
That would be a person I would actually be concerned about, because, like I said, violence, that would be unusual, that degree of violence. So in my mind, I would start doing like violence risk assessment. So no, the person is not gonna likely be locked up, honestly. But for me, that's a red flag. People who actually would do harm to animals in that way, that would be a red flag. Mm-hmm. I need to do another assessment, because maybe something is actually done.
Yeah, I told you my wife pissed me off. So instead of throwing her out the window, I just threw the dog.
Let me tell you, working in the VA for like the 8 years that I worked there, I saw a lot of angry men. I would say like that's real common, and that is something I've never even heard.
No, I would agree.
Well, I told you. I got you on that one then.
Right, but that's also, like I said, people with mental health, they're not likely to be violent. So
I appreciate that you are definitely repeating that, because I think that really is a common myth, and you're not helping. But that is definitely a common myth that exists around like individuals with mental health, is that they're the ones who are going to be volatile. They're the ones who will be acting out in violent ways towards others, and that really is not true.
Yeah. And Meal Prep Monday here with Dr. Leigh Ann Dooley and Dr. Bethany Ketchen, and we're discussing mental health in the community and also debunking mental health issues in the community. So that's what we want to do. We got these two lovely ladies. We want you to go and see them for professional services. Don't go in there and try to shoot your shot.
Don't do that. Because you have that stank face we talked about earlier, that's what you get.
Oh, okay, see? Y'all gonna get that stank face. See?
Yeah, you'll get that.
Because ain't nobody finna lose their job for you.
No. All right, here we go. How do I seek counseling? How do I find a counselor? So if I'm just right here walking down 85 with my dog, how do I seek counseling?
So I'm going to leave that vignette behind. The scenario, I'm leaving it in the past.
All right.
Just like I'm willing to leave 2020 in the past, I'm going to leave that scenario in the past.
How do I find a counselor?
I'm going to leave that.
How do I find a counselor then?
So there definitely are many ways that you can find a mental health counselor. So you can go through your insurance company. You can go through psychological associations, like the Georgia Psychological Association has a search function. The American Psychological Association has a search function to look for providers. A resource that people don't necessarily think about are colleges and universities that have graduate programs in psychology. They often have training clinics. So there you will have a student who is supervised by a licensed psychologist. And often those rates are a lot lower. They have sliding scale fees, so it makes it much more affordable. In addition to that, there are community service boards that exist. Those services are often provided at a much lower rate to the community as well. So there are a lot of ways that are to access mental health services in an affordable way. And during this time of like COVID, you can see in like, there are a lot of commercials and ads you see for online therapy services as well. So like BetterHelp, Talkspace are two that both Dr. Dooley and I are familiar with that provide like services virtually, which I have to say, out of COVID, if there is anything helpful that emerged, I think that has been quite helpful, because on like teletherapy, online virtual therapy has made it accessible to people who may not be able to travel to in-person appointments because they just have whole lives that they are trying to live. And so there definitely are many ways to access to find information about therapy resources.
And I would just add there, since one of the primary functions I do is medication, that don't discount your primary care doctor. So if you have symptoms that are, I would say like mild to moderate, and you need medication for depression or anxiety, you can definitely use your primary care provider as a resource. And really don't discount word of mouth. Like if you have a friend, if you have a family member who's seen a mental health provider and they're having a good experience or they talk positively about them, ask them, in our work, we can't see family members, but I can refer them to another person in my clinic. But it's not uncommon that people say, hey, my daughter needs to see somebody, hey, my son or my cousin or whoever, and ask me about it. So don't discount word of mouth.
Okay, yeah, that's it. That's it. All right. So Michael Burton Meal Prep Monday here. We're here with Dr. Bethany Ketchen, and see, I got in trouble today. I kept putting an S on there. I kept saying Ketchens. And Dr. Leigh Ann Dooley checked me. She checked me. She said, your name is not plural.
There is only one.
It's not like Kroger's, we got to take that.
I do that every time. Every time. It's Kroger's.
No.
So let's say I go through all these networks that you guys talking about, right? And what, if I'm already struggling day to day with my finances, I mean, is counseling expensive? Can I just talk to my girlfriend, my wife, and be like, hey, I talked about it. I saw a psychologist with my wife, girlfriend, my significant other. Can I cut corners like that? Or how expensive is it for me to just pay for the real thing? Someone that actually went to school for.
I'll take that.
Yeah, I think that that is such a great question. And like we talked about debunking myths. And I think there's nothing wrong with reaching out to your support network, but seeing a psychologist or another type of therapist or psychiatrist, it really is different. It's more than just talking. So there's actual research-based, evidence-based therapies that you are able to get for treatment. So, for example, you might talk to your mom, about your anxiety every single day, but she may not be able to help you get out of the house, let's say if you're having panic attacks and you're anxious all the time.
Yeah.
So sometimes just talking and having conversation isn't enough to really help you really resolve your symptoms. So seeing a therapist, they actually know a type of therapy. For example, cognitive behavioral therapy. That's a specific type of treatment that's used to help people who have anxiety. So I'm glad you brought that up, because that is also a myth. Oh, I just talked to this or I talked to this person. When you come to therapy, yes, there's talking, there's support, but there's treatment. And to me, that is definitely different from having those conversations. As it relates to the cost, so yes. When it comes to insurance, because of the ACA, Obamacare, as they call it, we're supposed to have mental health parity, which means that mental health is supposed to be covered equally as medical, other, non-psychiatric treatment. To be honest, in real life, that doesn't always translate. So sometimes people have very high copays when they see psychiatrists or psychologists. I know Dr. Ketchen mentioned earlier about like sliding scale fees. Some people's sliding scale fee may be less than your copay. So if your copay is like $75 or $100 per visit, some therapists you're seeing every week, you might ask them, let's be honest. A lot of times if you say, hey, this is my income, I make, this amount a year, and really this is what I can afford to pay. If they have a sliding scale, they are often willing to work with it.
Can I just pay you under the table?
It's not under the table. A lot of therapists actually, they take insurance and you can pay cash. And so you can do both a lot of times. So it's not under the table. It's okay to do it that
What
way.
about food stamps?
We don't have a stamps no more. If you want to get your EBT, like the passcode, turn it up. No, I'm just kidding. No, you're not gonna be able to pay with that. But a lot of them will work with you. So don't think that you can't afford it. You can always ask if they have a sliding scale.
Hey.
And if they don't have a sliding scale, usually most like psychologists or providers in independent practice will have on their referral list other providers who do take sliding scale. So even if you don't necessarily work with that provider, they can refer you to someone else and make a suggestion.
Okay. Well, my wife swear I got these. This is what she self-diagnosed me with, right? She said I got split personality, which I'm on the fence about, and something about me needing all the attention. I think that was a real medical diagnosis for those.
I would never suggest that, given all of the macrame and monograph.
You would be attention seeking.
You hit me with the stink face now.
Nice.
I wear these when I'm out with her. I don't know why she don't crave the attention.
She may have a point. Something to consider.
You should see this when I wear this to work. People just taking pictures with me and all this stuff.
You mean to your day job?
Yeah. To my day job. Yeah, this is real wear.
I feel like I have a scene from Coming to America.
Not Coming to America. I'm gonna get you, sucker. Antonio Fargas when he getting out of jail. And he wearing all that old gear
with the platform, with the fish in it.
Yes.
Gotcha.
Yes. Yep.
Gotcha.
All right. What about this one right here? Will my insurance pay for it? So I think you kind of already answered that, Dr. Dooley. Yeah. Mm-hmm. So insurance gonna pay for y'all. Even the insurance I got with Lil Tony. I'm gonna file with Lil Tony, and he gonna take care of that part.
Lil Tony might be out of network. I don't know if Lil Tony is in network.
What? Man, he just said bill him. He on counter. He on counter.
Oh, he okay. Oh, yeah, he ain't.
Man, what? Okay. All right. How can I get into the mental health field? First and foremost, why would I even want to get into mental health? What made you ladies get into the mental health field? Y'all ain't got nothing better to do?
No, actually.
Oh.
So, no, I can't imagine doing anything different than the kind of work that I get to do now.
Meal prep.
And so I feel like I could start so what is the question is, why did we get into mental health, or how okay. Yeah. So I would say I definitely started to get into mental health because I had an interest. Actually, my interest first started with HIV work back in the day, this would have been, I'm going to date myself, in the early 2000s, late 90s, early 2000s. So I had a family member who died in the mid 90s, a straight African-American woman who died from AIDS in the mid 90s, when Black women were not even thought to be part of the AIDS epidemic. And so to kind of watch her have to navigate all of the medical field and then all of the relationship and social everything made me interested in working with communities that are traditionally stigmatized. And so I continued that. Really, once I started to get into graduate school, I worked in the infectious disease clinic at Grady. I worked in the sickle cell clinic at Grady, and just really became invested in trying to give people who have diagnoses that are stigmatizing the best care possible. And so that is reflected in the work that I do now with folks who are homeless, who have substance use disorders, who have been incarcerated, some who still have infectious disease diagnoses like HIV, AIDS. All of that is reflected in that work, and that I get to have people recognize help people recognize they really are a whole person and are not defined by the diagnoses they have. So that's the why. And I can tell you the course for a psychologist, but that is definitely the why.
Okay.
And I think for me, the why is that I was in medical school and really thinking that I wanted to be an OBGYN. And I did that rotation and was like, no. You know, as you go through medical school, you realize that we all have different skills. Like some people have the skills to be a surgeon, you know, some people have the skills to be a neurologist, you know, they're like thinking people, they can figure things out. And one of the, I feel like the gift I have that lets me do psychiatry well is that I'm able to be with people in the time, you know, for most people come to psychiatry, it's not a good time. Oftentimes it's their worst time and they're in the worst place that they can be. And I'm able to be with that person in a moment and still able to like leave that kind of situation without really taking it with me. And that's something that not everybody can do. People have a really hard time listening to other people's problems when they're in dark places. And I realize like I'm able to do that and be with people and support them and still able to kind of leave it and be okay myself. And you realize that's a skill that you really need in psychology. So I feel like I'm pretty suited for it to help people in those dark places.
All right, cool. Michael Burton here, Meal Prep Monday. We're on with two of our great mental health providers, Dr. Bethany Ketchen and Dr. Leigh Ann Dooley. So last question, ladies, and I can free your time up. What advice do you all have, I guess, for the community as a whole, or you know, what type of advice would you want to leave us with?
I guess this is like piggybacking on what you were saying before, is that mental health treatment, psychotherapy is more than just talk therapy. It's not just talking, that there are real evidence-based treatments that work. And that, you know, basically there is hope that people do not have to suffer. People really can get better and everything, and they can learn skills, they can learn tools that they can use going forward to help them manage symptoms if they return. So people really can get better in mental health treatment.
And I think what I would add to that is, as a person who writes medication, and I find that there's a lot of stigma and worry around people who take medication for mental health conditions. And let's just bust one myth. The goal of taking medication isn't to be a zombie. That's probably the number one concern people have. Will I get addicted and will I be a zombie? And you know, those answers are no. If you're taking medications, if you're scared of it, please talk to your doctor. If you're having side effects, let them know. Because talk therapy is helpful, but sometimes people do need medication as well. I think we need to kind of break the stigma about people who need medication for mental health.
Yeah, that's what's up. So, is there a way that let's see how I can say this. You know, just want to leave people with. Do you have an outside profession that, you know, people can reach you at? If they can't find these other resources, you know, are you guys referral only, and or how can someone, you know, sign up, or I don't want to say sign up, self-sign up, you know, to see one of y'all, if I can say it that way?
From my perspective, I work at Emory University, so there is a referral process. You can search my name. I think it's listed there, but you can search my name. There is a process, insurance, and we also take people who don't take insurance. So if people are looking to see me professionally, as you know, my Instagram, realdeal.dooley, that's the way to find me outside of professional spaces. We talk more about body positivity and things of that nature, but professionally, that's where I work, and people are perfectly fine to look me up there if they're interested in seeing me professionally. Okay.
And here comes the tricky part. Dr. Bethany Ketchen, you guys got to use a rotary phone. Go to your nearest phone booth, put in that quarter, right? That's what, stank face, never mind.
That's right. That is what that is, like 100%. So
break out the flip phone.
Right, because clearly I do not have any social media presence, like, period. But, and I'm also not in private practice. But if there are folks on many platforms that you are currently on who are veterans and eligible for VA care, they can certainly access services through the VA here and stuff. And so I would recommend that course. But I am not in private practice in the Atlanta area. Right. Though Dr. Dooley may try to change that for me. At some point in the future.
I know.
Right.
Well, ladies, I definitely want to thank you all. This has been one of the most productive Meal Prep Monday sessions that I've ever had, and I mean, I can't thank you all enough what you lovely ladies are doing, not only for the show but for the community as a whole. And I definitely admire you all. Y'all hear my badass kids in the background. They getting ready to bust up in here and be like, "You on the call?" So try to cut it off right now while everything is good. So I definitely want to thank you, ladies. And let's give up a round of applause for these ladies right here. A round of applause.
Thank you for having us.
Thank you, ladies. All right, thank y'all.
Take care.
All right, bye. All right, you guys. So, Taz, you guys still on? So that was Mental Health in the Community with Dr. Dooley and Dr. Bethany Ketchen. So mental health is real, you guys. If you take it for a joke, don't take it for a joke. It's real. It's not anything that we can laugh at. I know we talk a lot about money and all the outside stuff that you can see, but a lot of things are going on in people's head on the inside. So you want to always seek out counseling. If you haven't, if you know someone that's going through these issues, please seek them out, especially if they're going through, suicidal issues or they're expressing those to you. So seek out help in the way you can, but don't try to do it alone. There's professional help out here. There's people that do this for a living. So, this is Michael Burton signing off from Meal Prep Monday. Taz, I see you guys on the flip side. Thank you for joining the show, and we out.